Good morning, and thank you for joining us at the GI Patient Summit. I'm Dr. Benjamin Weinberg, and I'm joined today by my colleague, Dr. Miles Braun. Dr. Braun directs an educational initiative at Georgetown Lombardi Comprehensive Cancer Center to bring integrative approaches to optimize the health and quality of life of adolescent and young adult cancer patients, survivors, and caregivers. The two of us collaborate closely on a pilot program focused on our early onset GI cancer patients. Today, we'd like to talk about what integrative medicine means and how these treatments can enhance the standard of care. Dr. Braun, again, thank you for joining me. Can you briefly define what integrative care means to you?
Well, first, thanks to the GI Summit for inviting me, and thanks to Dr. Marshall and you for collaborating with our integrative initiative. Integrative care is a collaborative effort with the patient or the survivor, and the patient has control over this, and we try to meet the patient where they are. And this is an evidence-informed field. We try to base what we do on good quality studies, and leading professional organizations such as ASCO, the American Society for Clinical Oncology, are beginning to endorse the practices that I'm going to talk about today and to recommend them. This is not alternative medicine, so it's not in opposition or instead of the conventional or standard care, but it's really a collaborative relationship working together with the physicians and the oncologists who are primarily responsible for treating the patients. The other part of what we're doing is it's not treating cancer itself. What we're trying to do is to improve wellness and reduce suffering that's associated with cancer and its treatment. So we don't claim to be able to cure cancer, but we do try to help with pain, nausea, peripheral neuropathy, people being worried or sad, having low energy, not sleeping well, being stressed, and all of these are common occurrences. So you can look at integrative medicine as having several components. One is lifestyle medicine, the things that we do that we have control over. It could be sleep, could be exercise, it could be diet. It's the social interactions we have, reducing stress. And we bring in mind-body medicine, and I'll talk more about that in a little while, I think, as we get into the interview. And sometimes traditional medical practices, things like acupuncture is an example of that.
Yeah, and for those of us at Georgetown, we kind of work in this pursuit of cura personalis, which is the cure for the whole person. And as a medical oncologist, I am often very focused on the cancer, where it is, how we're treating it, what's not working now, what do we do next, what do we do after that. And it's very easy to kind of lose kind of grounding in sight of, the whole person, right? And you alluded to a lot of stressors that are not even directly effects of the cancer itself, but all these indirect effects on, lifestyle and anxiety and a whole host of issues, and that our young onset population is especially attuned to. So when you're trying to design and build an integrative medicine program on top of our sort of pre-existing oncology clinical program, what are the components that you're looking at? What type of services do you offer?
Well, what we have and started in the adolescent and young adult program is massage, and this is therapeutic massage, and it's performed by licensed massage practitioners who are trained in oncology care, and they work for a nonprofit that's called Heal Well, and we've had them about 20 months working in our pediatric clinic with patients age 15 to 39, and it's been extremely well received. So that's one of the modalities, and the patients are served their caregivers, because as we know, it's such a difficult situation for caregivers of patients, and they have their own stresses and challenges. So the massage is open to them, and even staff of MedStar Georgetown University Hospital if there aren't patients at that moment or caregivers. The staff enjoy getting a massage. We have acupuncture, and that's again a licensed acupuncturist that is at our hospital, and she's came from Mayo Clinic several years ago, and that's been very well received also. We get very good feedback from the patients about these services. And then I provide some educational components to interested patients, and that could be around things like dietary supplements or mind-body practices, things like yoga, tai chi, breathing exercises, stress management. I'm always promoting exercise. There's a nice promotional material from the Mayo Clinic that says exercise is a secret weapon in cancer care. And the idea is just to keep people moving so they don't lose muscle strength, so they don't have clotting in certain parts of their body that might happen when they're not active. And it also increases mood. It helps mood when we move. So that's another piece of it, and sometimes help people with strategies for sleeping better. So those are some of the things that I do. And I should mention too, the clinicians, the oncologists will ask me sometimes for information about dietary supplements that patients are taking. And that's a whole area that is really actually complicated. And I would say to anybody listening to this, be very careful about dietary supplements that you take, especially if you're in treatment, and to check with your physician. But our oncologist will ask me sometimes to go into more depth. And I should mention here that part of the reason that Dr. Turetsky, who's the head of the AYA program, and he's based in the pediatric side, he opened the door to my starting this program 4 years ago, was because I served at the FDA for 14 years, for 8 of them as a division director, and I was responsible for post-marketing, so monitoring of safety of products that are already on the market, particularly vaccines. And sometimes also we were involved in the approval process, and also did research in these areas ourselves. So it allows me to critically assess the medical literature as it relates to supplements. There are also any of these integrative modalities that I've been talking about, because there are studies evaluating them. And when you get into the details, it really helps to have a background in reading and writing the medical literature. So that's some of the ways that we provide services in this area.
Yeah, I would, highly second what you said in terms of please run whatever supplements, over-the-counter herbs, things that you're taking to your oncologist, because there could be potential interactions with the treatment we're offering. We'd hate to have our things like chemotherapy, targeted therapies rendered less effective for sometimes lack of benefit of certain supplements. And then the other thing you said regarding exercise, I believe ASCO just came out with their first real recommendations in terms of exercise and things of that nature. We do know for folks who are colorectal cancer survivors that exercise far and away is the sort of main mechanism to decrease risk of recurrence and future disease. So I highly, again, even for folks on active treatment, but especially after treatment, we know exercise is very important. I know we had a study with one of our former fellows now and attending, Dr. Samantha Armstrong, who's at Indiana, on acupressure. So you mentioned a little bit about acupuncture, but she was actually able to demonstrate in a small study of GI cancer patients where acupressure, where you're taught certain pressure points and how to self-administer this, which is obviously easier than something like acupuncture, which I imagine would be harder to self-administer. That they were able to improve things such as nausea, fatigue, and is that something that you all do as well?
Yes, and we just before I got on this meeting that we're having right now, one of our oncologists sent out a referral for acupuncture for an inpatient who's actually an adult who has neutropenia, so very low white blood cell count. And so for that reason is not eligible for acupuncture, for having the needles. And we also sometimes have patients who have low platelet counts, so their clotting is not ideal. And so for those patients, as well as patients who don't like needles, those are the really three reasons why they will get acupressure. And it's very well received. And so our acupuncturist does teach the patients how to do that, and also their caregivers, because sometimes there are hard to reach spots that would be helped by acupressure. And so we do that, and it gives the patient a sense of control to be able to apply acupressure themselves, and they don't have to, if it's 3 a.m. and they're having an issue that they'd like some relief, they're not going to be coming in for an acupuncture treatment. So it's a wonderful kind of empowering and control-giving thing to have acupressure. And also, so our massage therapists will even tell patients some things that they can do, and this is bordering on acupressure, that the patients can do for themselves, or again, the caregivers can provide it.
And you had mentioned, a number of symptoms, and that, acupressure and massage may help with. What specifically, aside from kind of just feeling better on a global level, do you expect or talk to patients about what benefits they may derive from those specific treatments?
Well, with the massage, people feel better while they're getting the massage. It's calming, and people feel relaxed. It's a way to actually connect with another human being. The massage therapists that we have are interested in doing that and connecting with the other person and meeting them where they are. Sometimes there are musculoskeletal pains. The referral that we had today for acupressure, is a patient who has a really significant illness, but is having some musculoskeletal pain, is bedridden, and there are parts of the person's thigh that are uncomfortable. And so applying gentle pressure to that can relieve it. And that's been our observation for some anxiety. If people are, and it's normal to feel anxiety in the situations that our patients find themselves, and they can get relief from acupressure, acupuncture, and massage. The acupressure, puncture, and massage, sometimes there's music that's played along with this, and it allows people to take a break from whatever's troubling them, and these effects can last longer. Now, with acupuncture, there's anxiety may be helped, and even some of the leading organizations that I cited, they recommend it in that situation. Anxiety is one, pain, and you can apply acupuncture to the painful place, but also other spots of the body that are remote from it, and that can help. And there are a number of different indications, and chemotherapy-induced peripheral neuropathy is also one that's actively being studied with positive results from some leading medical centers with acupuncture.
What advice do you have to patients or caregivers who are listening to this and say, wow, this is great, I really want to get this as part of my overall care plan? How should they go about doing that, either at our shop or elsewhere? What's the approach that you would recommend?
Well, as I said earlier, and this is important, is to meet people where they are. So we come to whatever challenges we face with our life before that, and the foundations we've built, our habits and our practices. That's one thing. Some patients come to us and they already have a yoga practice. I will tell you, it's not common, but it has happened. Or they have a meditation practice, or they're seriously exercising. On the other hand, some people don't have any of those things. And the key, I think an important distinction is in this field is the motivation of the patient. So if you are the survivor, and if you you don't need to be even conscious to receive massage or to receive acupuncture, but when you talk about doing a mind-body practice, about changing your diet, and things of that nature, exercising, it takes some motivation. So people start where you are. I think if someone's interested in this area, you might think, what do I need? What's bothering me? What's your concern? So in medicine, you'd call that the indication. Is it you're concerned about your weight? Or are you out of shape? Or are you having some pains? Are you anxious? So that's one way to approach it is, what do I want to improve the most? And then that can help narrow down how you dip your foot or your toes into this area. So that's one way to do it. And once you do that, you can there are a number of different ways. You can go to websites, and the National Cancer Institute has a couple, and we're going to post these after this interview so people will have access. There's a National Cancer Institute, also at NIH, a National Center for Complementary and Integrative Health. Those leading medical centers I mentioned, MD Anderson and Sloan Kettering, they have very helpful websites. In our community in the Maryland, Virginia, DC area, there are community organizations like the Smith Center, Hope Connections, Life with Cancer, and they also allow you to have groups. And now with this virtual interaction, you can be in a group with someone in California, but these local support groups, so a cancer patient or cancer caregiver support group, where you're online with 7 or 8 people, more or less, and you can share experience. And that's really can be valuable to connect with someone who's going through or who's gone through what you're going through as a patient or survivor. So we have some of those organizations in our community. And then there's some books. For example, when I first got into this, Anti-Cancer Living by Lorenzo Cohn, who's a professor at MD Anderson and the University of Texas. So those are some of the things. Also, I can meet with selected patients who are at MGUH, Georgetown, and you can do that through your physician. And if they don't know about me or our program, because it's still relatively new, Dr. Weinberg can connect them to me. And so I can help people orient to this very wide, it is wild sometimes, and beautiful area of integrative medicine, and help you to get a foothold.
And we will post a list of resources online on the Roosh website. Well, thank you so much for your time today, Dr. Braun, and all you're doing for our patients. And thank you for those of you listening.